Very often I'm asked this question, what is the best age to get a hair transplant done? So today in this video, we are going to talk about this in detail. Hi, I'm Dr. Mayank. I'm a board certified plastic surgeon, diplomat of American Board of Hair Restoration Surgery and founder of Crown. Getting a hair transplant done is an investment that you make. But obviously there is a concept about the donor and recipient ratio. When we talk about the donor area of a hair transplant, it is usually the side and the back of your scalp, and apart from that, some body reserves as well. When we talk about the recipient area, it is practically everything from the front till the crown of your scalp. Now, when we are looking at a person getting a hair transplant done, what importance does age play? Normally, hair loss happens at an age of around 16 to 17 years of age in today's date. What we used to see at 24, 25, 26 originally is now happening much earlier, and that is only because of the epigenetics, the lifestyle, the pollution, the chemicals that we have laden in our foods, the kind of lifestyle that we are living, and obviously even basic amount of pureness in water is not available for us. So obviously all these things are preponing what used to happen at much later ages. So if someone has started experiencing hair loss or hair thinning at an early age of around 16, 17, 18 years of age, this is not the time for you to jump in for a transplant. Why we say so is because of the fact that the future progression of your hair loss goes to what pattern is not something which would give us that clarity as of now. So obviously the earlier ages before 20, 21 years of age is somewhere where we normally advise going for medications. When we talk about the ideal age of getting a hair transplant done, it is usually in the range of around 25, 26 years of age, going onwards up to around 50, 60 years of age as well. Why is it that we talk about 24, 25? It is because by that time, relatively, the hair loss has started stabilizing with the medical management that you have been advised. If you have not indulged in any kind of medications, then it is always advisable to first start with medicines, stabilize your progression of your hair loss, and then go ahead with a hair transplant. The ideal age to get a transplant that usually is a referral point beyond 30 years of age, where the stabilization is even better. But obviously for someone who's suffering with hair loss in the early 20s, with the peer group having normal hair, and obviously with the kind of lifestyle that we have in today's date, with the kind of exposure to the social media, we cannot expect people to have the suffering of the self-confidence being hit by the hair loss or recession of the hairline and trying to camouflage it with different artificial means. So anytime that you feel you are having that kind of an impact psychologically because of your hair loss, do talk in detail with your surgeon and talk it out. Don't go with standard guidelines that this is the age or that is the age. After having a complete discussion, you would be genuinely told what is the best age to get it for you. When we talk about young patients jumping in for a transplant, obviously the criteria that come into play is the donor management. The donor area in today's date as a 20-25-year-old may be limited in terms of the span or density, or may look like it is a vast donor area which is available. But when the progression of hair loss is going to happen, at that time, only the centralmost part of your donor area, which may be 5 to 6 centimeters height, is what is going to remain if the advanced grades of baldness happens in the family. Hence, the younger the age where you're jumping in for a transplant, the more is the important part of the role of medications that comes along with your transplant to maintain your results for the longest possible time. Also be clear that this is not going to be the only hair transplant that you will undergo. You may require multiple sessions over a period of time as well. Simultaneously, let's talk about the other end of the spectrum. Many patients come to us at the age group of 50 to 75 years as well, where they are professionally and personally accomplished, they have lived their lives, and now they want to do something as an investment for their appearance. They don't want to look bald anymore. They don't want to have that kind of a recession of the hairline which they have had throughout their lives. And I've even had people who have come to me at 74 years of age and said that I have lived bald entire life and I don't want to die bald. So the indication for you to undergo a hair transplant is not something as per your age. Yes, You need to be medically fit. So obviously you should not be having anything which is uncontrolled in the format of diabetes, blood pressure, cardiac ailments or anything. If all these things are existing in your medical history but are under control with medications, you are a safe candidate to go ahead with a hair transplant. Also, what is important is as we advance in ages beyond 50 years of age, the donor area also continuously thins because of the aging phenomenon. So obviously your surgeon needs to assess that the donor quality is still good and the number of follicles as healthy follicles which can be extracted from your donor area are available for us. Apart from that, your physical health in the form of you taking the surgery time is also which is critical. So if you consider a hair transplant, it is a surgery, even if it is a 2500 or 3000 grafts surgery, you would normally take close to 6-7 hours of surgical time. So it's a long day, it's a tiring day, plus you cannot move a lot during the surgery. So obviously there will be time when you would feel that your neck, your back and other things are stiff. It will be totally painless, but it is tiring. So your physical health should allow that as well. Along with, obviously, your mental health, that you are understanding every aspect of it in the format of realistic expectations. If you have all these things, then definitely you can be a candidate for a hair transplant even at 65 or 70 years of age. Now let's talk about what are the exceptions to these age limits, specifically the lower younger males who come to us with hair loss, or even younger females for that matter. If you have a recession of your hairline, where your hairline has receded and you're feeling conscious about it, you feel underconfident, you feel psychologically hit, not just balding or even progression of your recession, if that is also causing the problems for your psychological element, where you don't feel like going out for social events, you don't feel like going out and meeting people, friends, you always want to keep it camouflaged with a cap or a hat, and you're feeling extremely underconfident and conscious, then do not hold on to this feeling that you have to wait till 25 or 26 years of age. You can get a hair transplant done. The youngest male I have operated till date has been at around 19.5 years of age. Unfortunately, the patient had major depression because of the hair loss that the person had. We had put him on medication since he was 17.5 years of age, but after 2 years, he stopped exiting homes, he stopped going to college, he stopped interacting with his peer group. So when this kind of an episode happens, the psychiatrist himself talked to me and said, till his hair loss is sorted, I will not be in a position to handle that. So obviously, if it is something that's impacting you so deep within inside, then you don't need to wait for it. You can do a hair transplant, understanding that the hair loss is going to be progressive in future life. Now, when that happens as a progression, you may not have adequate donor to cover the advanced grades of baldness that can happen in future. In that case, you may have to jump in for a hybrid system of hair restoration where your front and mid may be transplanted, and if you don't have the match of aesthetics in terms of your body hair, or you don't have adequate donor area reserves or body hair donor supply, then you may have to go with a part patch in the back area to cover the rest of the crown area that develops. You will have to use medications for a long period of time. So these are things where we have taken exceptions beyond the ages which have been considered for hair transplant. I hope this gives you the clarity of what exactly should be the kind of criteria of age and what should be a good age to get a hair transplant done. If you still feel that this is not clear to you, do comment below or contact us on the numbers given below, and you can have an in-person consultation or a telephonic interaction where I would address all your concerns and questions. Please do like and share this video and subscribe to our channel for similar content. Thank you so much.